Well, welcome back. Joining us in the studio this week, we have two very special guests, Ms. Katherine Bonincontri and Ms. Libby Roberts from the Pascal Youth and Family Services. Ladies, welcome to Week in Review.
Thank you so much.
So Pascal, tell me about Robert Pascal.
So Bob Pascal is probably one of the most extraordinary human beings I have ever had the pleasure to know.
Wow.
For anybody, and that's the truth, that's the truth. For anybody who doesn't know who he is a former county executive, but essentially he has a huge heart for philanthropy. He's dedicated a wing to our Baltimore-Washington Medical Center. He gives large sums of money for projects that he deems worthy, and I was fortunate enough to meet him. He's also an All-American football player for Duke University. I had to put that in. I know.
I love Bob Pascal.
Until that moment.
No, I still love him, but man.
But he loves for me to say it, so I'm going to put that in there. But Bob has the biggest heart, truly, of most people I've ever met, and I've met a lot of really amazing people, but he's just an amazing human being.
And an excellent county executive.
And it's true. If you live in this county, you've definitely heard the last name Pascal.
Absolutely, absolutely.
Now, the full name.
The full name of the organization is Robert A. Pascal Youth and Family Services, Inc. And our new service that we have a soft open that has started since May 1st. And we're actually having our ribbon cutting ceremony tomorrow at 3 p.m. I am so excited to say.
Congratulations.
Thank you so much. Finally, at long last, the Pascal Crisis Stabilization Center.
Wow. Say that
Okay.
3 times fast.
Okay, so now that we've gotten all that out of the way, tell us what is unique about the Stabilization Center. How does it work?
Well, it's an innovative program, nothing like it really, and simply that's because we are providing a crisis facility for people who are suffering from an acute mental illness and a crisis that comes about and they really have no one else to turn to. We have opened our doors, we have a very loving therapeutic environment, and it's very unique in that it's housed within a very large building that is occupied by a large substance abuse provider, Gadenzia Inc.
Gadenzia.
And so we occupy a wing of that building, of that facility. We are two different agencies entirely, but they do substance abuse and we handle mental health. And so it's a unique fit because it allows anybody who's in our facility the option, if they fall within that same population, that they have somewhere to go. They can connect to a service that would help them further rehabilitate with their illness.
Treatment is needed. It really, really, we knew for the last, many, many years, and everyone is becoming increasingly aware of how vital this actually is. So many deaths, so much crisis going on. I knew for probably a decade that our county could use a crisis stabilization center of this size and have this kind of breadth.
Because the complaint you always hear is when someone's ready for treatment, they can't
Where do I
find
go?
anywhere to go.
Where do I go? My family member needs X, Y, Z. Where do I go? How come we don't have something as an alternative to taking them to the emergency room? Or now they've acted out and they have a behavior and now they're in the custody of the police. Why don't we have another option before it comes time to actually make the 911 phone call? So we gave the county an option, and it's been long coming. We've been working on this.
We're glad you're here.
For a long time.
We're
Really
excited.
exciting, and it's admirable the work you do. When we say things like a crisis, so does that mean that no appointment necessary? If
Right.
you need help, just come to the back door?
That's right.
correct.
Very good.
That's right. So we have the crisis response system, which I used to, as Dave probably remembers, back in the day.
That's right.
I ran the county's crisis response system for about 7 to 8 years. And at that time, that's when I identified that actually this crisis stabilization center was needed. We need somewhere to drop off people when we find them, not the emergency room. They're already flooded with folks that, capacity is truly an issue.
And
at
it's
this
It's a
point.
little bit more of a delicate situation.
And it's like catch and
Requires different
release.
care.
It
I mean,
is.
it's like you
It
go to
is.
the emergency room,
That's
they
right.
keep you for 24 hours,
That's right.
and then they just let you go.
That's right. As opposed to a crisis stabilization center where we can actually have someone stay with us for 10 days. So if you have someone for 10 days and they need housing, they're disconnected from any mental health treatment, they've not had substance abuse treatment, they haven't had any of those services at all, and they're not connected. It doesn't take 24 hours to find the answer. Sometimes we need days and phone calls upon days and phone calls. Well, 10 days sometimes just about does it. So we have had a wildly successful first soft open month, and I
Good.
have inspiring stories already just from the first month of being open.
Very good. Well, yeah, let's get into one of those stories. But first, let's talk about a little bit more specific. What are those services that we can expect here?
Well, one of the great things about our crisis center is that upon discharge, we can help somebody further with their outpatient treatment. So we have traditionally Robert A. Pascal Youth and Family Services, which I realize is a mouthful, was an outpatient, strictly outpatient facility. So we were an outpatient mental health office. We were providing counseling, one-on-one counseling, group counseling, family counseling to children ages 5 up to adults of all ages, and we were also doing medication management. So this is very unique in that if someone comes in the door from our crisis center, we could, upon discharge, if they are not connected with anybody else in the mental health field, we can provide them those services through our outpatient facility as well. So it's wonderful. It's a unique experience, really, for someone who's suffering.
Somebody can actually meet their therapist in the crisis center and say, I feel connected to you, I want to continue with therapy, I want to continue taking my medication, I want to keep going. Can I see you outside of here? And our answer is actually yes.
That's amazing.
So it establishes relationships.
Yeah, because once you have that trust, it's really hard
Absolutely.
to start seeing someone brand new.
That's right.
Absolutely.
That's right.
So the important thing is, so now people know about you. How do they get in touch?
How do they-
Where are you located?
Yes, so 107 Circle Drive is the physical location.
In Crownsville.
Absolutely. I will tell you, though, that the larger community has learned to call that crisis warm line.
Sure.
Call and ask if they are a good fit for us. Do they need to have someone come out to wherever they are at the moment of crisis? Because obviously that would be the mobile crisis team, the hotline, what have you. We do have a direct phone number. We are starting to pass out all of those cards. They are, we're fortunate that our phone systems are rolled together so that if one comes in the wrong place, it can be rolled to the other location. So we're trying to create a no wrong door approach so that, and I used to make a joke that people need treatment and sometimes they come through the back door or the window when you're not prepared for them, but that's what it takes. That's what it takes.
Yeah.
No wrong door.
Tell us how the soft opening's been going.
It's been really
So
exciting.
excited. I want to.
You should come visit.
Yeah.
You should come and visit. You
Love
should come
to.
and visit. It's great.
It's been really exciting, but we did have a really special guest, we call them, who came in, who left us a very touching letter that brought us both to tears when we read it. It was very touching. So to know that we have had that impact on somebody in our first month of being open was really rewarding.
Well, it fills a huge need, and some people are paying a lot of attention to this, some people a little, but really the list of things that have changed in the last 2 years regarding treatment options and services that are available is a long list.
That's right.
And so, there's a lot of easy ways to find out what you need to know. Obviously, our county website, aacounty.org. We have the hotline number up on the screen, the warm line number, that you can call. So there's really, you can't say that the resources aren't there. They're there. So call today. Go to a meeting.
That's right. We are getting better and better and better. And truly, we've had amazing county level support. We've had some amazing DHMH level support as well. We would not be open, honestly, were it not for a few people that I hope to actually really thank and highlight. Our county executive has been incredibly supportive of having this finally come to fruition that we've worked on for so many years and wanted so badly. I can't thank him enough, and there are a few others that I plan to personally thank in a much bigger way than I've ever been able to before tomorrow when we have our ribbon cutting.
They're happy to do it. It's for a good cause.
Yeah, and you just came across a big grant, correct?
We did.
Very good.
Through the
Congratulations.
Maryland
Thank you.
Community Health Resources Commission, which is
Wonderful.
also a bit of a mouthful, and we got that right. They've been wonderful. So the Maryland Community Health Resources Commission is comprised of 11 commissioners, all appointed by the governor, who you present in front of, and they make a decision as to who they're going to award funds to.
And here we go.
And here we are.
We are one of the lucky recipients of one of their grants, and it is very powerful to have people who understand that this kind of innovative idea can actually work, can actually be replicated in other jurisdictions. That was one of their main interests, actually, was that this is a cost savings, because a level of care that is required that is not emergency room level, because that is very, very expensive. And I liken it to, sometimes people will say, well, I need to go, I sliced my toe, I need stitches, I need to go to the emergency room. Or maybe could you go to the urgent care center, because
Right.
they can probably sew up the toe,
Right.
and that will work, and that's a huge savings with time and money for that individual. We look at ourselves as psychiatric urgent care. We are like a large center for psychiatric urgent care, but you can also stay there for 10 days. If that helps the public understand what it is that we do,
Absolutely.
we can get you in the door faster, just like an urgent care can for other health things.
Well, ladies, congratulations on the opening, on the
Thank
grant.
you.
Very much deserved on your success so far. And thank you for all the hard, important work you're doing. It's very inspiring. We appreciate it. You're welcome back on the show anytime
We'd love
you
to
want to
come
come
and tell you
back.
Come back
some
and check on
stories
you.
of our folks.
We love inspiring stories, so
Yes.
we want you to come back. And we'll be right back with more Week in Review right after this. Don't go anywhere.